Hello friends. Welcome to my channel. I am Dr. Balaram Dhotre. In the last video we discussed about the burden of chronic diseases in India. What was the result of this discussion? The cardiovascular diseases are increasing every year. What is the solution? Now I will discuss about the way the government is trying to reduce the burden on cardiovascular diseases. Then I will give my opinion on that. Attempts to prevent CVD in India. After discussing the burden of CVD risk factors, let's examine the strategies adopted in India to prevent and treat cardiovascular diseases. These policies largely follow the recommendations of the WHO. However, it's important to note that many of the strategies adopted in India are based on those implemented in Western countries to combat the epidemic. Prevention and treatment strategies. The strategies adopted should have been on the underlying cause of heart disease. The strategies adopted are based on reducing mortality by reducing the risk factors. For example, a reduction of tobacco use by a certain percentage will reduce the death rates. Similar is the case for other risk factors. Reduction of tobacco use by a certain percentage will reduce the death rates. To the best of our knowledge, no data currently evaluates the impact of macroeconomic policy and non-personal interventions on cardiovascular disease, CVD, in India. However, modeling studies suggest that significant benefits could be achieved by imposing taxes on tobacco, palm oil, and sugar-sweetened beverages. To combat obesity and diabetes, we propose imposing a tax on sugary beverages. Studies estimate that a 20% tax on these beverages could lead to a 3% reduction in overweight and obesity prevalence and a 2% decrease in the incidence of diabetes mellitus. Furthermore, to reduce CVD deaths, we suggest raising the tax on palm oil purchases. Modeling studies predict that a 20% tax on palm oil could avert approximately 363,000 deaths, a 1.3% absolute reduction, from myocardial infarctions, MIs, and strokes over 10 years. Reducing CVD deaths by a reduction in salt intake. A moderate reduction in salt intake among middle-aged Indians, specifically a 3 gram per day reduction over 30 years, can potentially avert nearly 400,000 cardiovascular events, including heart attacks and strokes. This reduction in salt intake could also prevent an estimated 81,000 deaths, representing a 5% decrease in cardiovascular disease mortality. Smoking. Finally, smoke-free legislation and tobacco taxation together may avert 25% of MIs and strokes in India. Action taken by Government of India. The Government of India raised the excise duty on tobacco products in 2014 up to 72% and levied a new 5% tax on sugar-sweetened beverages. The moves taken are commendable. My opinion on cardiovascular disease in India. There are two ways to look at the cardiovascular diseases in India. Firstly, the policies adopted by the Government of India depend upon what the world organizations like WHO, CDC, and American Heart Association say. They believe in risk factors as the cause of cardiovascular diseases. So, their policies will be nothing but recommend the reduction of risk factors. Reduction of risk factors is not the ultimate solution. The root cause of any chronic disease boils down to cellular dysfunction, micronutrient deficiency, or more particularly essential nutrient deficiency. I have highlighted these points in my book Unraveling the Root Cause of Chronic Diseases. A proper understanding of the root cause is essential for preventing as well as reversing chronic diseases. The true cause of heart disease or cardiovascular diseases is the deficiency of certain essential nutrients that are essential for endothelial function and collagen synthesis. The link between vitamin C and heart disease is well established and documented in the scientific literature. Tips for cardiovascular health. Government authorities will likely continue to focus on risk factors as the primary cause of cardiovascular diseases and other chronic illnesses. In the near future, we shouldn't expect organizations like the WHO or AHA to significantly alter their current stance. Ultimately, your health is your responsibility. You need to understand how nutritional deficiencies impact your well-being, as this information is often not adequately addressed by doctors. So, what should you do? I recommend purchasing my book on Amazon to enhance your knowledge of diet and nutrition. Remember, our entire body is constructed from the food we consume, the water we drink, and the air we breathe. Every single part of our body originates from these sources. Our bodies are constantly undergoing renewal, with numerous cells dying and being replaced daily. Consequently, it's imperative to provide our bodies with the necessary nutrients. This is a fundamental truth for maintaining good health. You must understand these principles. I hope you liked my video. If you liked my video, please like and subscribe to my channel. Thank you for watching.